executives. We combine that with expertise from outside of healthcare. So national risk and analytics experts and security experts as part of that. The social determinants of health, you can't turn around in a conversation today and not hear somebody talking about it. It's so what? What's the real answer that is out there? Most of the current solutions today are reactive. They're single issue. They lack scalability and sustainability. And arguably what the healthcare ecosystem needs is a risk framework that looks at social risk, combines that with clinical claims information, and creates a tangible ROI solution. So we look at that problem and we solve it from two different perspectives. What's going on in the community where people live, they work, they play, they pray? And what about the people themselves? There's specific challenges, whether we think of them as a patient, as a member, as an employee of that. And then together, how we identify variation in clinical outcomes, in cost, and experience. And socially determined, we've created an analytics platform dedicated to the science of social risk. We do that so that we can quantify and visualize that risk combined with clinical information and disease burden, with claims information where people go, their geography, and where they live. We consume and process more than 130 data sets from federal, state, local resources. We combine that with commercial data about communities and about people themselves. And then most importantly, we integrate that information with the clinical data from a health system, from their EHR, the claims data from a plan, screening, programmatic data, and we deliver products back to our customers, whether that's geospatial visualization of what risk looks like in your community, individual person-level risk scores around food insecurity, housing instability, lack of transportation, or economic well-being. We create cohorts of patients that share financial, clinical, utilization, and geographic patterns so that we can intervene in a way that is impactful and precise. And we create predictive models around those subpopulations to be able to focus there. So let's make this a little bit more real. We have mapped the entire United States across 6 different categories of social risk: housing and transportation. This is food insecurity for the state of Maryland. Darker the color, the higher the level of risk. This is Baltimore. Because we map at a 200-meter resolution. Think about that, 200 meters, and able to distinguish heterogeneity and social risk at that level. We can roll it up. In this case, it's a catchment area for a hospital. And on the ground, look at those pockets where, again, in this case, food insecurity impacts our members and our patients. As we think about what that really means, how do we combine that data, that risk in a community, with the people themselves that we have the opportunity to care for? So this is mothers who have diagnoses of gestational diabetes and hypertension, and who also, the difference between them, the ones that live in an area of high food insecurity versus those that don't. And what we see here, this is real data from HSCRC, rolled up around the catchment area for LifeBridge in this case, is a $3,800 difference in the annual cost of care. But we know that our patients, our members, people in our communities don't have single problems. In this case, this is economic risk combined with food insecurity. When we focus on those combined problems together, for 728 women alone, a $4.5 million opportunity, $6,300 difference per year for those people. An unbelievable opportunity to focus with precision. We allow our customers to survey broadly across hundreds of thousands to millions of people and dive with precision and focus around opportunities that are impactful. We believe that we are changing the way that we all look at healthcare by designing science around the social determinants of health. So thank you for the opportunity to talk.